Many patients present to the clinic with hearing loss, and sometimes their hearing loss may be associated with pain and drainage, and the patient is in some acute distress. But some cases of hearing loss have been long-standing, not necessarily associated with pain or drainage, but maybe worsening to the point where the patient is now having some difficulty functioning either at work or in the case of children, they may be having difficulty with their speech development or their school performance. And so these are the most common reasons people might come in for an ear problem. The first step is to examine the ear and actually determine if there's anything that is acutely inflamed or infected and requires some sort of immediate treatment, with the expectation that the problem will then be, completely dealt with and resolved. But sometimes patients need deeper evaluations or more thorough evaluations in the form of hearing testing. The hearing testing allows us to learn about what's going on with the ear beyond where our examination can take us. So in other words, if we look in the ear with one of those handheld flashlights, we can only see up to the eardrum. But we really can't tell what's going on with all the important structures of the ear beyond the eardrum. So we can learn more about that through a hearing test, which can be done very easily at the time of the visit. And so the hearing test will often lead us to what our treatments may be. Some forms of hearing loss are treatable with medications or office procedures. It could be cleaning the ear or draining the ear with tubes, which can actually be done in the office. We have equipment such as microscopes where we can administer those forms of treatment right in the office. But sometimes it gets to be a little more involved, and we may prepare the patient for some sort of procedure that's done in the operating suite. Other forms of hearing loss may not be treatable with either surgeries or medications, and particularly those in older adults whose hearing losses may relate to the aging process or noise exposure or health conditions. We may counsel them about the availability and utility of hearing aids. And we also offer hearing aids at the Everett Clinic. Given that there is probably over 35 million Americans with hearing loss, I have concerns that many people don't seek care for it. Because it's not a painful condition. They think they just have to live with it. So it's good for patients to realize that they should be seen by a physician for hearing problems, and that there is in fact treatment available for it.